I'm Jonathan with Ascent Physical Therapy. I want to take a second and talk about biking and knee pain. Although knee pain is common with cycling, it's not normal, and if you're having knee pain, it needs to be addressed. There's a whole world of bike fitting, which is a part of controlling knee pain with riding, and that involves highly expensive equipment, trained professionals. But there's also a few simple things you can do at home, and I want to go over two of those right now. First thing we're going to look at is the height of your bike seat. Second thing we're going to look at is how far forward you are on your bike and how much your knee has to bend to go around the pedals. At home, you can use a string and a plumb bob, or here we're going to use a laser to help us find the position of our foot over the pedal. Put your bike into a trainer, lean it up against a wall so you can balance, or have someone help you steady it so you can just get on the bike and pedal around. Get on your bike, do some light pedaling to find where you are comfortable on your bike, and then to find how far forward you are on the pedals, stop with your pedals flat or level to the ground. There's a faint laser line here, and we'll do a close-up. As you can see, that laser line falls right behind my kneecap through the middle of the pedal. If you find that your line, either laser or that string and a weight, is in front of your kneecap, you're too far back, move your seat forward. If you find yourself way over here, it means you're too far forward, you're bending your knee too much, and that's a pretty common source of knee pain. Bring your seat back so that when you're pedaling comfortably, you land again right ahead of this bony bump and behind your kneecap. To find your height, pop your heel out, put it on the pedal, and slowly move to the bottom of the pedal stroke. You should find yourself able to move through that bottom point without having to tip or twist through your back or tip your hips, but it shouldn't quite lock your knee out entirely. If you have a lot of bend in your knee, you're probably too low, and that's a really common source of knee pain. So after you've looked at your bike fit, and things look mostly right there, you want to talk about what the tissues are doing when you're riding. Cycling is a really long time in one place, and you load the tissues very consistently, and there's not much variability. So when you're done riding, you want to do a couple things to help relax the tissues. I like two simple stretches that focus the hip and change the way the knee moves. Using something to balance yourself, kneel on one knee, and then from there, you're going to take your pelvis and try to push it past your knee and get a stretch across the front of your hip. We're looking at a muscle called the psoas. And I want you to do that probably 2-3 sets of 10 and focus on just rolling in comfortably, developing a stretch, and then relaxing. You don't need to hold it for a long time because we're really asking the tissues to relax and move more easily, not necessarily get longer. The second one is very similar, and it takes a little more balance, but grab your foot behind you and perform the same stretch. If those two things don't do it, it's probably appropriate to start looking at how you're using the muscles while you ride. The two exercises I want to take you through are a squat assisted with a ball that's going to become a single leg squat, and a hamstring curl. They're both long duration loads with a stability component, which are important for how you run your knee when you're cycling. Put the ball behind your back, and you can start as simply as just doing a squat. I imagine most people will be able to progress pretty quickly to working on a single leg squat, and what this does is it asks the hip to produce stability while the knee generates power. This is a big part of what cycling is, and if you don't have that stability from your hip, you tend to load your knee in ways that it's just not designed to be done. The hamstring curl, lay on your back, putting the ball underneath your heels, performing a bridge, and performing a pretty similar exercise, but laying down. From here, pulling straight back, raising your hips as your heels come back, loads your hamstrings, again asking your hips and your core to produce stability while your legs produce power. Both these exercises have similar ideas. That's because a lot of the challenges we have at the knee are to produce stability for the rest of the body while your legs are isolated and able to produce power. If these things don't help, it's worth talking to your healthcare professional or a bike fitter for some more specific answers. If you have any other questions, please contact us at ascentptnw.com. Thanks for watching.